Hi, my name is Lana Norgard. My presentation is on evidence-based practice for umbilical cord care. The purpose is to determine the best practice for umbilical cord care to prevent infections in newborns. My PICO question is, in neonates, how does dry umbilical cord care compare with topical medications in preventing infections in the umbilical cord? Some nursing organizations and units that can benefit from this evidence-based practice include nurseries and NICUs, the Association of Women's Health Obstetric and Neonatal Nurses, the National Association of Neonatal Nurses, and the Academy of Neonatal Nursing. Search methods that I used were I found articles that were peer-reviewed, 5 years old or less, and had research studies with dry cord care, which is current practice. My first article is on alcohol versus dry cord care. The hypothesis was that the 70% alcohol being used in the study group would be more effective than preventing infections than dry cord care. Their findings were that there was no signs of infection in any of the newborns in this study, and that the dry cords actually detached faster. My second article compared olive oil and dry cord care. They hypothesized that the olive oil would have a higher microbiological efficacy than dry cord care. The findings were that the olive oil actually had a higher incidence of microorganism growth, and the detachment of the cord and presence of microorganism were not statistically significant between the study and the control groups. So olive oil is relatively safe, but the dry cord care had less microorganism growth and would be considered safer. In my third article, they researched dry cord care versus antiseptics. The researchers hypothesized that antiseptics would be more effective in preventing infection than dry cord care. However, the findings were not statistically significant enough between antiseptic use and dry cord care. Only 3 babies in the dry cord care group got tonsillitis or infection of the umbilical cord. And so both the dry cord care and the antiseptic use are actually considered relatively equal, but dry cord care is actually less cost effective, and since it's equally as good, it should be practiced. Some nursing implications would be to keep the umbilical cord dry. You want to allow the cord to dry or to detach naturally, and you would want to avoid submerging the cord. So until the cord falls off, you're going to perform sponge baths. Because while the cord is still moist and not closed off all the way, microorganisms can be introduced to the cord. You also want to fold the diaper down so it's not rubbing against the cord, and you want to leave the cord open to air. Overall, umbilical cord care is found to be very important to prevent infections because these infections can lead to possible sepsis. And the studies that I found with the topical agents had no statistical significance, even though they may be considered effective. Dry cord care had a lower incidence of microorganism growth, and it's more cost effective. So dry cord care is considered the evidence-based practice.